And here's the current HHS Region 4 Special Pathogens SITREP. First, to Nigeria, where the Lassa fever virus outbreak has continued. In the latest official report from the Nigeria Center for Disease Control and Prevention on the 11th of May, there have been a total of 720 confirmed cases since the beginning of this year, down from 883 at the same time last year. But with 140 fatalities this year, there's a higher case fatality rate of 19.4%. Challenges continue to be due to late presentation of cases, high costs of treatment, poor awareness, and poor sanitation in the hardest hit areas. Next, since our last SITREP on the 26th of April, Uganda declared an end to the Ebola Sudan virus outbreak less than 3 months after outbreak confirmation. 14 cases, 12 confirmed, and 4 deaths were reported. This was the country's second Ebola outbreak in less than 3 years, and there was a truly fast, coordinated, and effective response. And to the east in India, where in the state of Karnataka, chiassoner forest disease has been confirmed the cause of a third human death this year. Since the beginning of the year, there have been 151 confirmed cases with 3 deaths, and the most recent patient, who was 74 years old, developed, unfortunately, multi-system organ failure and died of cardiac arrest. And in Iraq, there have been several new confirmed cases of Crimean Congo hemorrhagic fever, or CCHF, in the past few weeks, with at least 1 fatal case and concerns for household transmission. This is the beginning of peak season for CCHF, which is transmitted by ticks, and thus far there have been 47 confirmed cases with 9 deaths in the country. And lastly, since our last SITREP last month, there have been no new domestic cases of H5N1, or highly pathogenic avian influenza, in humans that is, and it's unclear if this is due to a lack of actual transmission or lack of surveillance and diagnosis. At this time, plans that had been in place to develop an H5N1 vaccine have been canceled by the U.S. Department of Health and Human Services, and globally, Cambodia yesterday did report the country's 4th fatal case this year in an 11-year-old boy. Finally, there have been no reports of suspect or confirmed patients with special pathogens of concern in Region 4 at this time. For more resources, visit us on the web at scdp.emory.edu.